Then the person was like, sorry, nurse. Then I was like, why did he shout again? Then he was like, he was just correcting himself. Then I was like, this person's a clown. Because I was just standing in front of them.
We are going to talk about what really is happening outside, which is misconceptions against the healthcare professionals and even against the healthcare system in itself. Before I collect the jam to go into nursing, it has never occurred to me that I would go there and earn big money, because in my society, I never saw any big nurses. I mean, like driving big car. You would never see nurses driving big car in the community. So where are people getting this misconception from? Because there is glaring evidences around them. There's this misconception that people believe, as intelligent and as brilliant as you are, why did you settle for nursing? Nursing is not a course you settle for. Have you seen people in nursing school?
Settle quoi?
Have you seen people? How many people started? I mean, like more than 60 of us started where I trained, nursing, university, college.
They will see me away.
They see how many of us graduated?
I mean, mostly here every time, oh, this nurse was heartless when I was trying to give birth. They didn't even take pity on me, no empathy or whatsoever. They were shouting at me that, comport yourself and all like that, which is not an excuse. Nobody should be treated that way.
Absolutely.
Nobody should be treated that way. Everybody in the hospital wearing a uniform, a white uniform in some places, in some other places, different colors, and nurses. That's why they say if a chew is rude to you, they'll be like, that nurse is rude.
Exactly.
If you go to some private hospitals that they've got quacks, they don't know
any female, even if it is a doctor that is female, in as much as you are female, they see a female face.
They think
that nurse is rude, even if it is a doctor.
That's where we say the overworking of people. When you overwork people, it leads to overtime frustration. And when the frustration comes in,
emotions.
Yeah. Like you said, there's a space for your faith while receiving medical intervention. But I just believe like the people like misconstrued the effect of faith and their own personal condition. The patient died. Sadly, the patient died. Then the acts, they were pointing at me that I was the one that told them to give her. I was like,
I don't
without pain, I'm already going to be sent out of nursing professional.
Hello everyone, welcome to another episode.
Welcome back
on our podcast. We're so excited to be back. I am personally. Maybe because I had a better week than Taiwo did.
You've got jokes.
And my name remains the same. It's Oyinda for everyone.
And my name is Taiwo.
Of course we know.
Jokes. So
earlier when I said I had a better week, maybe you want to tell everybody at home what happened to you over the week.
It's just work. It's just like every other person. When you work for someone or you work for yourself, there are times like you get stressed, things don't go according to plan. So you just have to put up with the worst name, put up with whatever happens and try as possible as you could do what you could only do. You can't do more than yourself. And sometimes you go the extra mile, sometimes you're unable to go the extra mile. So like this week I went the extra mile and it tired me out, but I'm happy.
Okay, I mean, in as much as the whole week resulted in on a good mood, and I would just advise you to use your weekend to do something fun. All right.
This is fun.
Absolutely, I agree. So we said we were going to talk about ourselves today and advocate for ourselves and for the healthcare system we work in or for. So we are going to talk about what really is happening outside, which is misconceptions against the healthcare professionals and even against the healthcare system in itself. Something caught my eye over the last maybe few hours or a couple of days ago.
Yeah.
There was a woman who posted something on Twitter, and then I remember we discussed sickle cell anemia the previous episodes.
Yeah.
So if you do not mind, could I read it to you?
No.
All right.
We all want to learn it.
Yeah, sure. The woman says, I need information for sickle cell anemia. 3 of my kids got sickle cell disease. They all wear glasses. Literally, we all wear glasses, including ourselves. So my 3rd boy has serious vision issues, and unfortunately, the specialists haven't been able to understand why. So he's seen different specialists. Even with glasses, he can barely see. So this is giving me more silent concerns, as it is well understood that the medical practitioners here in Canada doesn't have enough information or treatment plans for sickle cell as compared to Africa and Europe. So this is what I'm told. It could be wrong. I will appreciate any information that's legit to help him, the child with retinopathy, vision problem. I think I'm actually diverting the answer to everyone already. So now, I am more bothered about asking about the help she needs. I wouldn't say Canada does not have that sophisticated healthcare system to understand exactly what is causing this vision loss. But from our previous episodes, we did talk about a complication of sickle cell anemia being retinopathy, right?
Yeah, we should probably talk about.
Did we not? To refresh everybody's minds, including ourselves. Retinopathy is a condition whereby the visions are affected from sickle cell anemia. And then when you remember from our previous episode, if you haven't watched, we would advise everyone to go back and watch.
Go and watch it.
Our eyes as it is, they are being supplied by blood. And then when the blood is sickled, and like we said, we are not getting enough transfusion or transmission into systemic circulation or for everyone with the sickle cell. So now that is exactly what, if the woman is able to see this video, I do believe from pathophysiology and anatomy, it is basically what is causing the child to lose their vision. And it could explain also that there are severity to this sickle cell disease. Because the first two children, their vision is not so good, yet they haven't lost theirs as the last son. You would tell that the last son case is worse than that of the other two children.
Yeah.
Basically that.
So people made several suggestions of where they could go to Nigeria, because I think the information reached many Nigerian populace. I think the person is originally Nigerian too.
Okay.
So now, well, I'm curious, because when I see sickle cells, this is something we've discussed. This is something we discussed last week.
Previous episode,
So that prompted me to go to the person's page to see if there would be more information on the sickle cell. I came across other things, whereby this person says, they had 3 kids with 3 sickle cells. And then apparently maybe they've tweeted in the past, because from comments on our post, retweet and repost, some people made a comment that the last pregnancy, that she was given the option in Canada that she could terminate the pregnancy, because since she's had previous pregnancies, they were SS. And then she chose to give birth to the last one, which happened and came out to be also a sickle cell diseased child. So now, this is the thing. There's coalition between faith
I've got so
and
many
religion.
questions. So many.
I know. Because, that was what was going through my mind too. So many things were going through my mind when I read the story. So now there is coalition between faith and medical practice.
Do you ever think, before you go, do you ever think they could be separated? Our faith and medicine?
Maybe personally, I think from this story and people's responses to the post, there were a lot of people against faith. What she's done. Not faith. People were not against her faith, but what she's done and the husband. And then there were people who were praising her to have believed that God would do a miracle. I believe in miracle too. But I think what I saw was that there is personal conviction and perception and faith. And then there is also what should be the norm in the world of medical practice, and what can be norm or what can happen miraculously in the world of religion and faith. As a person, I know I can distinguish and I can separate my faith from what I know is right. I looked at this person. Location says Canada. They are in a first world country. People would advise them. They have the best healthcare system. But you can't expect, from that, I know in a way, she blamed the healthcare system of Canada in a way that they couldn't treat her children the way they should have been treated. So, you can't blame people who do not have the right research, the right knowledge into what that does not affect the general populace or the higher percentage of the populace. So, and this brings me back to what we said in our last podcast, that we say sickle cell affects generally and mostly the Black communities. Yeah, whether you are in Europe, or whether you are in America, you are in Canada, it's mostly Black. So now I think this should, before we label anyone, we are not trying to label anyone, but before we talk about this will bring us the misconception that people believe that healthcare workers, we do not know all. We are not God that can do and undo and that can perform miracle. It's a misconception in a way, because, we are not God, we accept that. A doctor cannot change the genotype of your son or your daughter from being SS to A, or from AS to AS to AS, or AS to A, and the likes. But the thing is, when you've had your first child who was sickle cell, diagnosed of sickle cell, you went on to have the second one out of your faith, diagnosed of the same sickle cell disease, not even AS, not AC, nothing else. So, and you were given the right information, the choice to terminate the last one. So why?
It might be against our faith to do abortion.
You may be right. So now, misconception in a way, this is like a fight between what we know is not right and what we know is right.
There's, how do you call it now? Definition of insanity is doing the same thing over and over again. Like you said, there's a space for your faith while receiving a medical intervention. But I just believe the people misconstrued the effect of faith and their own personal conviction, like you said. The first thing most people talk about in their care, that doctors and nurses are only in it for making money. They're only in it for the money. Have you ever heard about that before? Like when you say I'm a nurse,
every time people say, "Yeah, are you not a nurse or a doctor? Yeah. You earn a lot of money." I'm so flabbergasted every time I see people saying that, because if you could walk to Instagram or Twitter or TikTok, every time you see nurses, doctors, and everybody complaining every time their money is not enough.
Are they paying enough?
Of course, definitely not. Let's look into Nigeria as a whole. Do you know, up until this 2025, people are still being offered 50,000 naira entry level for work as a nurse.
You're saying 50,000. People are offered 15,000, 30,000 in private hospitals.
In year 2025.
Yes.
And it blows my mind, because imagine this. You as a person, people are there on social media, they are complaining about mama puts by the roadside who is selling food before you can have something that will benefit you for 2,000 naira. So somebody was collecting 15,000 naira. How do you want them to sustain the month? They will carry transport to workplace. They are going to, maybe they want to do such a person cannot even think of development. I'm sorry to say, it's not. They cannot even think of personal development. Maybe they have one sister or mommy or uncle or younger brother or siblings that they have to take care of. They have to train in school. And then there's this thing when people hear, "Oh, you are a nurse, oh my God, you're going to graduate," and then jump into money of 15,000 naira.
I'm still looking for the money.
As bad as it is, I don't even think I'm benefiting as much yet. Even people that are my seniors in this same profession, they are still complaining because the money is not just enough. You are being paid peanut.
I think the main issue people don't realize is a systemic issue. Doctors, nurses, healthcare workers, they are underpaid and overworked. Everywhere is short staff. You get to this place, we don't have enough staff. We are working under pressure. And when you don't get paid enough, and all you have is the passion that you have, that, I want to become a nurse, I want to become a doctor, I want to become a pharmacist. It's only the passion that keeps you going. You are not really in it for money. Because if you are in it for money, you could do a lot of other things that would give you more money.
Honestly, this is not because of this podcast or for the sake of this episode. Before I collect the jam to go into nursing, it has never occurred to me that I would go there and earn big money, because in my society, I never saw any big nurses. Like driving big car. You would never see nurses driving big car in the community. So where are people getting this misconception from? Because there is glaring evidences around them. You don't see nurses driving big cars. Even the doctor, well, maybe doctors used to buy Camry back then in the days. But Camry compares to other professionals. Engineers were better off than doctors back in the days. Maybe they're still better than them.
I mean,
they're still better than them.
It's just awful.
I mean, the only thing I knew about medicine then in the society is that people ascribe prestige to being a doctor, to being a pharmacist, maybe to being a nurse, not the quacks. When you are well read, people are they are called you with respect, with prestige.
Yeah.
But money, where? People don't tell you to go and study medicine or nursing because of money. They tell you to go and study because you are intelligent. So I don't know where people get that from.
That's not true. The long hours, everything, is just a systemic issue that needs to be looked into. Maybe they have open heart surgery on the healthcare system in Nigeria. So moving on to the second misconception that people have: government hospitals are useless. Public hospitals often get a bad reputation about long queues, strike, old equipment, and I'm actually like one of the person. I've actually said this on the podcast before about some of the equipment. No.
Oh, okay.
I'll never say they're useless. That some of the equipment they use are pre-colonial. They are pre-colonial instruments, which is actually true. But like I said, it's a systemic issue whereby the government everything boils down to the government. So like the government doesn't update the equipment they use. Update the hospital infrastructures. Everything is just left to maintenance. You're just maintaining it when you know that it's better to get a new one. The money you're spending on maintenance is enough for you to, because if take an example of an X-ray machine. Maybe this X-ray machine every 2 weeks is paused. I need to repair it. Would that not lead to longer queues of people waiting for X-ray? Most hospitals, let's say they have 2 X-ray machines, so you only have 2 X-ray machines. And it's all those X-rays that are fitted into a room, not those mobile ones. Those X-rays that are fitted into a room. Then every 2 weeks you repair it, and the repair takes it takes about 2-3 days to repair it. The people that are waiting for X-ray for 2-3 days, let's say each day about 20 to 30 people are waiting for X-ray. Right. Then when it starts working, people that are on the queue already for,
they bombard it again, overwork it again, and then the same thing keeps happening.
Why not just buy a new one?
I mean, Nigeria as a whole, we know that this question can be asked over so many other things. I want to labor on the fact that people say government hospitals are useless. I do hope people know that government hospitals, we have the secondary one, we have the primary one, we have the tertiary ones. So maybe we should break it down in layman terms. All these healthcare centers that we go to. Because I do believe that at least a small community or village should have, or town, should have one healthcare center that, cater to the healthcare needs of the people there. Everything that people misconstrue about the healthcare system or the healthcare professional, there's evidences for them to say otherwise. Has there ever been a day that people go to the healthcare center and they don't meet people there? Has there ever been a day? I have primary evidences. I've been there. We also work there, yeah? Except they're on strike. Has there ever been a day that people don't meet people when they work?
Maybe weekends. Some of them don't work.
Because they don't work weekends. Yeah. That is the only time. So the uselessness, I don't know where it comes from, because they are always overbooked. Healthcare professionals, they are always overworked. They are always present. You go there every day and then you see them still delivering.
I think I know where the useless comes from. I'm going to talk about the third misconception. That's where the useless comes from.
Well, uselessness. They have the professionals. Maybe because, maybe people still need to go through the healthcare profession and public health sector organogram. What kind of people can be within which setting? A doctor is not only servicing one healthcare center in your town if the only thing you have access to. It's throughout the local government. Imagine the number of healthcare centers in the local government. Maybe there are like 10 or 15 of them. The doctor, he has to go through all of them. So the uselessness still does not roll down on the healthcare worker.
The useless, let me talk about it now.
Okay.
Nurses are rude, or healthcare workers are rude. I mean, it's a common thing people say nurses are rude.
That we don't.
Healthcare workers are rude.
Is this part of your misconception, or that nurses are hackers?
It's misconception.
Do you have another option for nurses are hackers?
No, they just say they are rude.
Okay.
They are rude to them. Like the rude, it could also encompass the athletes. When you are rude and
exactly.
you don't have empathy towards their condition, so they'll be like you are rude, being mean. Not just nurses. I mean, mostly you hear every time, oh, this nurse was athletes. When I was trying to give birth, they didn't even take pity on me, no empathy or whatsoever. They were shouting at me that compose yourself and all like that, which is not an excuse. Nobody should be treated that way.
Absolutely.
Nobody should be treated that way.
If you're a first-time mom, make I tell you wetin nobody go tell you. You see all those your nurses that you normally see when you get to go to your antenatal, where they go dey shine teeth for you. Ah, Mrs. This, how are you? How are you doing? How is baby doing? You've added weight, oh. Whenever you do your scan, they'll help you stand up. You know, how are you feeling? How is your leg? Is it still swelling? When you reach time to born, you'll know who be who. You see that doctor where you dey feel say him face strong, where they do like say, you know, they say, get wetin they do, is so busy. Now go treat you like newborn baby. Now doctor, now go even come pop your love for your body the day when you want born. You come say na that nurse where you are in the shine teeth. Now what they do you like say, who be nurse and be get this? We dey vex, we fight. Now before you know, hello, we don't shout here. We don't, madam, please calm down. We don't. You and nurse fit fight. I remember the time my sister was telling me about how her friend and nurse fight. She dey labor, she dey follow nurse dey fight. She dey threaten nurse. Say she go show am because the nurse dey insult and the nurse dey bastardize and the nurse just dey do anyhow. She call the fight nurse. She won't finish now. She call the tell nurse thank you. Go hear say people dey dash nurses 50k, 100k once they don't born. But you see doctor wey dey form nice guy, you know, he dey pop your love for them, they show their love, they, you know, everything. You know the kind of shit. I never born yet, but I don't dey package golden terra oil where I want share for nurses. They go, why they no go appreciate? They go love it. Mama love it, man. Being a nurse or a midwife is not easy at all. That one I can tell you for free because there's no time off, there's no day off. Me will go born December 31st when people dey church, when people they thank God, say I thank God for the new year. I was in labor and those nurses had to attend to me, they had to take care of me, they had to make sure that they keep me alive. You know, there's so much demand on them. So I understand, say they self a lot of pressure, and that's why their hair they hot, their brain they boil, they know they talk well. But more na help us, more na calm down, I beg. We self we dey trying times. Pop your love for our body, I beg. Not to they drag us. We be people, children.
That's where we say the overworking of people. When you overwork people, it leads to overtime frustration. And when the frustration comes,
emotions.
Yeah, then take it out of
Let's
patients.
start with the fact that nurses, doctors, and every other healthcare workers are equally as human as you are. We are humans like every other people. When you get frustrated, you lash out eventually, yeah?
Yes.
But one thing people don't see is when nurses, when they get frustrated, or doctors, our own is like combined. Is we keep them inside cooler. So a day where we like combust, we don't go back again. That combustion is the new attitude people bring up. You may be surprised, the same mommy matron that you meet in the hospital that's so rude to you, you meet them in your church or your mosque or your local community and they are the nicest person you've ever met. What is it? The difference is in the setting. They are home where they feel relaxed. They are in their natural setting where they are relaxed, where they can bring out their normal self. The frustration is left in the hospital. They go back in the hospital and they're like, I'm back here again. Oh God, what am I going to experience again today?
But even at that, it shouldn't be mean to you. You should always show empathy.
But you should also know that the same way we say we nurses and doctors and other healthcare professionals are human, it's the same thing. People go to the hospital and because of their illness, they are also frustrated and they transfer the frustration onto the person they see. So you cannot be aggressive towards the people who provide healthcare professional to you all the time and expect them
to do something else. And why? I mean, it's no excuse, like we said, it's no excuse for someone to be rude or mean to the other person.
Absolutely.
You as a patient,
it is highly unprofessional.
Yeah, you as a patient shouldn't be rude to people offering you care. And
and we should define them as they are bullies. Whoever, if you are not a nurse or a doctor, you go to meet the nurses and doctor, you are rude to them, you are a bully.
Yeah.
But another thing is that there's also personality. There are some people that personality-wise, they are not the nicest people. So, and there's this misconception that people believe that we should always be nice. No, we can't always be nice. Personality-wise, everybody in your local community who are not into your healthcare system are not nice. We can only advocate that.
We should do better.
Exactly, that we do better. But, we are not always. So when you see 1 out of 3 nurses that's being rude, don't categorize every other person or generalize it as every nurse is being rude. People meet many people have met me in class and they say, oh, you're so nice, you're not like other rude nurses. I'm not the only nurse who is nice. Why don't you say you're so nice? I wish other rude nurses can be like you.
Let me join this with the next misconception.
Yeah.
Everybody in the hospital wearing a uniform, a white uniform in some places, in some other places, different colors, and nurses. That's why they say if a CHU is rude to you, they'll be like, that nurse is rude.
Exactly.
If you go to some private hospitals that they've got quacks, they don't know
any female, even if it is a doctor that is female, in as much as you are female, they see a female face.
They think
that nurse is rude, even if it is a doctor.
Let me combine you also with this about the rudeness about that, and combine with everybody wearing uniform and nurses, which is not. I feel like why do people let it go without correcting them?
No, doctors. I've come across so many posts.
No, not doctors now.
Even nurses.
I'm talking about nurses and CHU and health officers. Why are they not correcting that? Oh, this is my job, bro.
I'm so sorry. Well, they should. It is, but
and not to mislead people.
Exactly, but you will still be surprised that even when people introduce themselves as I am CHU Oyi, at the end of the day they'll be like nurse, matron. People are just. I think our mindset. I don't know the way it is built or that way. Once we have an idea, our own conviction that this is what I want to do. This is what I want to call this person. There's no going back. Because the same day doctors would complain that they've told their patient many times that I'm not a nurse, I'm a doctor. You still see the same person. If they told them now, you tell me, as we are conversing, I tell you, you say nurse, so, can you prescribe this, so. Nurses don't prescribe, by the way. And
they
do.
No.
As nurse prescriber.
Yeah.
No, not in that level.
Yeah.
So, and then I correct you immediately and I say, oh, I'm not a nurse, I am your doctor. You won't be surprised that the next sentence you would say to me, you'll be like, sorry, nurse.
Really?
Honestly, I said that happened real life. I was like, there's this lady I work with, a doctor. So she saw this patient after treating. I was like, could you take this to Nurse Ahmed? That was me. And then tell them to show you where the pharmacy was so you can get your medicine. And they're like, thank you, nurse. And the lady said, oh, I've corrected you many times. I'm not a nurse, I'm a doctor. And he turned back and said, oh, I'm so sorry, nurse.
That person is irredeemable because they've just decided that person was a nurse. Exactly. Let me give you an example. There was one day I was wearing my uniform in the hospital, like when I was training. Then I was in the outpatient department. Yeah. Then one person from all over there, doctor. And I was like, first of all, why are you screaming? Because it was not emergency department. There was no emergency. They were just screaming from all over the way. Then I was like, I'm not a doctor, I'm a nurse. Then it was like, sorry for the Yoruba, doctor. Then I was like it means, don't you want to become a doctor? It's nurse that become doctor.
Our study path is
then
different.
I was like, it's different things. Fine, I could get my PhD and become a doctor. But at the moment, I'm satisfied with my professional capacity of being a nurse.
Then the person was like, in education, not in medicine.
Then the person was like, sorry, nurse. Then I was like, why did he shout again? Then he was just correcting himself. Then I was like, this person is a clown. Because I was just standing in front of them, like, it did not need to shout again.
That's like a normal human being.
Because I think it was just because I corrected him. Then he decided to like correct himself with shouting what he shouted previously. Then I was like, yeah, this person is just a clown. I mean, I don't mean clown in a bad way, but it's just
like you said. I mean, many people still believe that anybody, like, it is just a generalizability effect, and at the same time, I don't know, should I say this? Because it is not, we are not just being labeled by men and even women. Maybe it is patriarchal or not, because this is how our society is built upon. Even women and men alike, any face they see in the hospital, as much as you're a female, you're automatically a nurse. Whether you are even an healthcare assistant, a cleaner, or unless they see you hold them up before they call you cleaner. Healthcare assistant, even till now in public health hospital, they are still calling them nurse.
That reminds me.
Healthcare assistant.
That healthcare assistant.
Yeah.
While I was training, sorry, I give a lot of examples so that I can see the relation. I was working in the emergency department. It was I think days, less than 14 days to cancel. Yeah. The council is the general exam we do as nurses to qualify.
Yeah.
So I was working there, even though I shouldn't be working in emergency department, I should be reading my book a few weeks to my final exam that is very hard to pass, by the way. Then I was working there. There was one cleaner, not really cleaner, don't let me say cleaner, an healthcare assistant. We have HCA or healthcare assistants that they are support workers.
They're the attendants, they're the assistants in Nigeria. There are two of them.
This one was an assistant.
Yeah.
But you know they all wear uniforms.
Yeah.
So this person, well, most of them, they do like they know the same thing as the doctors and nurses.
Because they've been in the system.
Because, most of them, when they think they've worked over years, they know more than you.
Yeah.
Which I find really ridiculous. And if anybody behaves that way, that person should be jailed.
And I think this mislabeling of people, nurses, it also gives power onto people that should not be making decisions. That's
why I say, like, everybody wearing uniform is called nurses.
You know that in hospitals, when you've been to UCH, because I know UCH setting, you know that people wear uniforms based on their organogram or based on their cadre. You cannot see an healthcare assistant or attendant wearing white like the nurses. Even if you call them nurse because you don't know what they are being called, and you were corrected, subsequently as patient or relative, you should follow that line of correction and call people as they are.
You know, it's something that is tough.
It exposes people to a lot of atrocities.
I think
on the path of, because when you give power onto the assistant, they can treat you anyhow.
I think what could be done in that kind of case, like the hospital I work now, they have people wearing uniforms, like pictures of uniform with their roles. Beside it, that if this person is wearing this color of uniform, they are nurses. This person is a porter. This person is a doctor.
My brother.
This person is a this.
We'll still see people that will still call them nurses.
Yeah, let me finish my story of that healthcare assistant.
Yeah.
So I was working in the emergency department. Then they saw this healthcare assistant. The assistant is the one that work together with the nurses to support them, probably do vital signs and blood pressure and all. So this healthcare assistant told them, because they've already asked me, like I said previously, there's a lot of things that are wrong in Nigeria. I was left to look after resource. And if you don't know what resources is in the emergency department, that's where the chronically ill patients in the emergency department.
We talked about resuscitation in our previous episode.
So it means resuscitation. Yeah. So resource is where they are kept, people that can't breathe by themselves, people with head injury that you need to pay close attention to. So that's where they are kept. Then I was looking after that place alone. The doctors, the nurses that were supposed to be seated in there, they all went out. I don't know where they went to, but they were short staffed during that day. They were short staffed to attend to other patients while I managed resource.
Was left.
If an estimate without pain. So this patient relative, they asked, want to give him pap. I was like, he has head injury. I don't think you should give him pap. Like, I know I'm not a professional yet. Yeah. Let me go and ask for people that left me in here. Because I can't give you an advice. I can only tell you what I know. I'll go meet the professionals that they've got pain and are responsible for the patient. As I went to call the nurse and doctor to ask so that they could come speak to the patient relative, guess what? They were already feeding him. They were already feeding him pap. Imagine, pap! That's how the man aspirated. Within minutes, he aspirated. Head injury, aspiration. Then resuscitation, we had to do CPR immediately. And the patient died. Sadly, the patient died. Then they were pointing at me that I was the one that told them to give her. I was like, with that pin, I'm already going to be sent out of nursing profession.
When you have not even started.
Yeah, like my career was over because luckily for me, there was another patient relative that was sitting in the resuscitation room saying, he warned you. This particular boy warned you not to give him pap. That he was going to.
Thank God for the witness.
Yeah, that he was going to, because most of all the patients in resource, they are unconscious or semi-conscious.
Imagine people lying against healthcare professionals.
So the
and such people will go on social media. They will say, "Oh, they killed your father. They killed my father."
So so the person was like, he was not the one. I don't know who told you that, but he was not the one. He told you to wait. Then they said, oh, they met someone outside wearing uniform like me. And meanwhile, that person was not supposed to wear the same. I was wearing scrub.
Yeah.
The person was not meant to wear scrub. The person was meant to wear their uniform, but they wore scrub that day. Then, I wasn't wearing my student scrub.
Yeah.
Because I think it got dirty or something happened to it.
So I had to wear blood or anything.
Yeah, something spilled to it. So I had to change into one of the scrubs from the hospital as a staff. So the person said, oh, I met this person outside. They said we should give him power. Then that's what happened. I was like, thank God. Like now, I wouldn't be sitting here.
So was it the
advice.
healthcare assistant that told them to give?
Yeah, but they couldn't find the healthcare assistant that told them.
Imagine that. This is one of the things we are saying. You met a random person on the way. Somebody who has not been beside your father or mother, or who has never been beside patient's bedside to look after them, does not know the condition of the patient, knows nothing about them, and the person gave you an advice to go ahead and do something, and you did. The blame is on you.
Yeah, the man died.
No, the person. Such families should never go outside and be blaming healthcare providers.
You were surprised. You were surprised.
People like that will go on social media and they would say, "Oh, they killed them. They killed my father." Killed how? It is your decision. You make that decision. You found a random person on the corridor. It could be you. It could have even been a cleaner. Oh my goodness.
Yeah.
I think we should move forward. I'm getting annoyed.
So I'm just going to run through the remaining thread. The first one is you only need to see a doctor when you're sick. And another thing is if you visit the hospital, if they don't give you drugs, that means they've not treated you. There are times that you just need counseling, you don't need drugs, but they believe you need to give them drugs.
Or you just will need rest. So, this thing online that people believe that in Nigeria, if they've not given you IV to flush everything,
yeah, that's another
misconception.
Yeah.
And that whenever you are, unless you are sick, is when you should see a doctor.
Yeah.
How would you know you have high blood pressure if you have not seen your doctor for routine checkup?
You don't even need to see, like another one is they believe that you only need to see only the doctor in the hospital. Meanwhile, in the hospital, you have different professionals. You have pharmacists.
We work as an interlocked system. We are all interlaced. Our roles are no one cannot be separated from the other.
Yeah, and nurses, most times people don't know nurses got specialist training. There are some nurses that got some specialization like advanced clinical practice, whereby you are able to consult and see a patient and treat a patient and prescribe medication.
I think maybe the one that is more prominent in the society are the midwives. People believe midwives, they are trained as midwives. There are other people, variety of people you meet within the hospital. Now in Nigeria, excuse me, there are people who are trained to become nurse anesthetist, or cardiac nurse, or nurses that went to orthopedic school. So they are the ones who look after people with bone related problems. They can even give you advice or health education and see you, consult you based on that. Different ones. So
I've got 3 more. The first one is nurses are just doctor's assistant. I'm not going to get you started on this. I know you've got a lot of
I'll leave it talk. I'll leave it.
Yeah. Please talk. I was just kidding. Yeah.
Because the thing is, in a way, men or male nurses still have it better than female nurses. No matter how good, how versatile, how diligent you could be or you may be as a female nurse, you are just nothing but an assistant to the doctor. And then maybe we also have to tell our colleagues who are pharmacists, doctors, medical lab scientists, that when they are dealing with nurses within the hospital settings, they should accord them with the respect that they deserve.
No, don't get me started on that, man.
So, and this is because the way these people treat nurses as well. I mean, patients and relatives are the onlookers. They see the way we are being treated, that we are being disrespected most times, and that is how they come to this conclusion that automatically we are nothing but the assistant to those people. That is why we are not respected as we should be respected.
But do you think in most scenarios that you see that most people that are getting disrespected, I know registered nurses get disrespected, but most places they see nurses getting disrespected are the quacks. When you see the way, most times in private hospital, you see the way quacks are being addressed or accosted.
Exactly.
Then you think, it's normal for
nurses to be abused like that.
Yeah.
So, excuse me. Then people go on ahead to commit the same, reaction towards nurses. Yeah. Then you see a nurse who is confident in herself, who knows her worth and virtue. You meet a well-educated nurse, and then they do not accept your disrespected or the rubbish you are bringing to them, and you automatically say nurses are rude. I mean, I stand not to accept your rudeness towards me. Does that make me rude as well? You are being rude to me. I mean, it is a defense mechanism for me to stop your reaction towards me. And then another thing is, I had a classmate, high school classmate, secondary school classmate, who I was like, we had this reunion. I said, I am studying nursing in the school of nursing. And they said, school of nursing. Did like that. I mean, this is the first time I'll speak about this publicly, except I speak about this with my loved ones. It's like my husband would say, they don't know better. That is why they did that, because where are they today and where are you today? Not every nurses will be successful. Not every nurses will make this nursing their profession. But then there's this misconception that people believe, as intelligent and as brilliant as you are, why did you settle for nursing? Nursing is not a course you settle for. Have you seen people in nursing school?
Settle quoi?
Have you seen people? How many people started? More than 60 of us started where I trained, nursing, university, college.
They'll see me away.
How many of us graduated?
We'll see me away.
It is like my husband was like, it is just ignorance. Pure and blissful ignorance would make people say, it's just nursing they study. Do you know the expectations of nursing, the cutoff mark for nurses? It is higher than many other healthcare professions you see. Go and look at the cutoff mark for medicine, for nursing, for medical lab scientists. Go to UI and look at their curriculum. We do everything. Everything. If people are ignoramus, this is 2025. People should educate themselves about nursing and what people study. How we become nurses. It is not easy. In a year, how many times did you visit your parents in a year for holiday? We don't get holidays.
You only get 2 weeks.
The 2 weeks, that is if you go within that 2 weeks. If you don't have anything to do. Exactly, or you are not on punishment posting. You may not get to see your parents or your relative or loved one for the whole 3 or 5 years of your training, wherever you go to. See, before I entered nursing school, I tell people that I was weighing close to 60 kilograms before as a young adult. I was weighing more than 60 kilograms before I entered nursing school. By the time I left, it remains small. I entered 30 kilograms from the stress.
Okay.
There are so many things you have to keep up on. You have to read a full syllabus.
Bonita, let's move on. Let's move on. I know you have
it's
a lot.
Absurd.
I know you have a lot. You have a lot.
I wish to go on a platform when we just talk about this topic.
We could actually talk about everything nonsense.
Honestly.
Let's make an episode just talking about everything nonsense.
Honestly.
The weight loss. If you want to lose weight, become a nurse. It seems like a good weight loss plan.
It is automatic. Do you know how difficult it is for me to lose weight? Go to nursing.
Alright, let's move on to. I still have a lot of misconceptions, and if you got any of opinions, we'll pull out a post soon. We'll release a post whereby we tell people to give us their opinions they have about healthcare and healthcare professionals. Then we'll have another segment to talk about your opinion. So please send in the comments, send in the videos, private DMs, whatever works for you. Just send it to us.
We are very, very happy to receive collaborations and then opinions and suggestions. There's another misconception. I know nurses are promiscuous. For people in layman terms that we are prostitute or that we are adults and we are just wayward. I mean, and then under this same topic that the healthcare professionals that we fornicate with ourselves, we commit adultery in the hospital. Oh my goodness.
I've got one question. Which is one. Where's the time? Where's the time?
Well, one thing is there was one information that circulated recently about the doctor, I think in Manchester or Birmingham, who left a surgery and his test.
Oh yeah, I saw that.
And an anesthetist that left the surgery room. He's gonna copulate with a nurse in the store.
Quickie.
I mean, that is a 1 out of 50 or 100 episodes.
How does that even call for generalization? Because one people, I believe it's not just healthcare workers that do that. I mean, people that work in banks, people that work in all facets of life, they probably do that.
Well, people find love wherever because the seniority is there.
That means
they believe that doctors, mostly married doctors or mostly married nurses or nurses mostly married nurses. Well, this is not because we work on the same ward or we studied at the same place. The thing is, where we studied, it is the same. When you attended the same university with people, these are the people you see. This is where you build your emotion. So we study within the same environment. So you, as a doctor in your own hostel, you attend the same religious group or programs together. When you see them, of course, if there are people that are your spec, you fall in love with them, not because you saw them on the ward. Has there ever been in the story of, well, maybe some...
You don't think so? You can see each other on the ward and just click.
Well, I've seen many situations where some nurses would see another student nurse and they, at the end of the day, they end up being married. That is right. But that does not, I mean, does that make a lawyer who went to win a case, who went to the court and you saw another lawyer that is your full spec, you approach them and you ask them out, and then the law of attraction and the similarity brought it together and you ended up marrying. So would we now generalize that lawyers also are promiscuous?
It's just like you said, it's just ignorance that people make.
And then they label us. We should tell it as it is. People label us because, or I mean, maybe because they bully us because we are just easy to be bullied. This is bullying.
There's this video, I think he sent it to me, or maybe we shared it, about a person went on a dating show, all those dating shows that you line up with balloons, and as soon as the person mentioned I'm a registered nurse, you need to see the audience
popping
balloon. I just found that just stupidity and
idiocy.
Because why being a registered nurse does not make me promiscuous? The person said, "Oh, his cousin is not unfaithful." You being unfaithful is you as a person, doesn't make you because of your profession. That's why you're unfaithful. I think
because there was another one that I saw in a discussion on Twitter that people were just discussing on how nurses are the #1 most promiscuous people in any profession, and one said, and they even do night shift. That night shift that you don't even know what they do there.
Probably they should come and do.
I mean, you can do voluntary service.
Do voluntary service.
I'm going to do a night shift in the hospital.
When you are your feet money to from the start of your shift to the end, I think we should just move on from people.
Exactly.
You should learn, educate yourself, and learn. As we've spoken passionately, like Oina has spoken passionately about some of the topics for today. I'm sure you've been able to learn one or two things, and we've corrected some of the misconceptions you've got about healthcare workers or healthcare providers and what they do in the hospital. And this takes us to the end of the episode today, where we've spoken about misconceptions and we've given you some advice to reorientate you as a person and re-educate you on things you need to do and what you need to know about healthcare workers. Do you have anything to say to close?
Absolutely. I just believe that personally that we shouldn't end this on this note. We have to educate people on the ethical considerations and the normal, their rights as a patient and as relative. Maybe we should do that in the next episode,
Yeah.
So
Oida said it. check out.
We will do it, promise. And thank you for joining us today again on our episode. This has been a very passionate discussion for me. I could go for 5-6 hours discussing this if time permits.
No Ozempic, go to nursing. You don't need Ozempic. You just become a nurse.
Okay, I mean, this is the time where we advise people again to kindly like our post,
Yeah.
and then do not forget to share,
comment.
and of course subscribe to our channel.
Yeah. Remember, your health is your future, your health is your wealth, and your health is your power. See you later.
Bye everyone.